Hey everyone, welcome back to the BioNexus Health podcast. At BioNexus Health, as you know, we place a lot of importance on parent education. And today I will be discussing one of three related topics. Today I'll be discussing about folate, cerebral folate deficiency, folate receptor antibodies. That would be the first topic. And the next recording that I'll be making is about leucovorin. And finally, I will also be creating a podcast to educate all you wonderful parents out there about milk, camel milk, folate receptor antibodies, the link between the two, and why camel milk can be used for patients that test positive for folate receptor antibodies. Because camel milk will be a natural way to provide the body with the nutrients that it needs. So very exciting, a series of three. Today is the first one, so let's get started. Let's go ahead with understanding folate receptor antibodies and their role in autism spectrum disorders. Let's talk about why folate comes up so much in autism conversations, other than the recent information that's been flooding the online support groups and information websites about folate. Let's just look at what the science actually is. If you are an autism parent navigating evaluations, different therapy options, or online research, you've probably noticed something. New terms keep appearing, words you may not have heard before, words your local doctor did not mention to you. Since, what most of us hear is autism is a lifetime diagnosis. There is no cure. There is no hope for good progress. You just have to accept that it is what it is. Many of us moms, myself included, as most of you know, refuse to believe that, and we just dive right in, exploring the science and information that is out there that has helped other children on the spectrum achieve amazing results. So, we end up doing online research, and words you thought you understood now feel a little bit less clear in this context. Now, one of those words that is a huge buzzword nowadays in autism circles is folate. You might hear it mentioned during a medical appointment, you may see it discussed in parent communities, or it may come up during one of your late night internet searches when you're trying to understand how different pieces of your child's biology, physiology, biochemistry, how they connect. In this episode, I hope to explain why folate matters to the brain, how it normally functions in the body, and why researchers pay close attention to it in the context of neurodevelopment. So, what is folate and why the brain needs it? It's important to know that folate is a type of a B vitamin. It plays a steady, behind the scenes role in how the body works every day. At its most basic level, folate helps cells grow, divide, and stay healthy. It's involved in making DNA, which acts like an instruction manual inside each cell. Because of this role, folate becomes especially important during periods of rapid growth. Pregnancy, infancy, and early childhood are times when new cells are forming quickly and when the brain and nervous system are developing at a remarkable pace. As the brain grows, it builds networks of cells that need to communicate with one another. Here, folate supports this process by helping brain cells form properly and maintain their structure over time. Does it work alone? Of course not. But it is one of several nutrients that the brain depends on during development. It's also important to understand that consuming folate is just the first step. Folate can come from food, from supplements, but the body must still convert it, right? Convert it, transport it, and deliver it to specific tissues. That is the most important part. Getting folate to the brain requires additional steps beyond just digestion alone. So let's look at how does folate get into the brain, and let's also check out the role of folate receptors. Now, the brain is a highly protected organ. It does not allow substances from the bloodstream to pass through freely. This protective system is known as the blood-brain barrier. I'm sure you've come across this term while researching autism or the associated condition of PANS pandas, right? Yep. The role of the blood-brain barrier is to carefully control what enters the brain and what stays out. Many helpful nutrients circulate in the blood, but they still need specific transport systems to cross this blood-brain barrier. And folate is one of them. Even when folate is present in the bloodstream, it cannot enter the brain on its own. So what's required? Let's take a look. To move folate into brain tissue, the body relies on specialized transport proteins called folate receptors, of course. Now, these folate receptors are located at key entry points, including areas that interface with the blood-brain barrier. Their job is to recognize folate, bind to it, and help move this folate safely into the brain to do its job. Now, one useful way to picture this is to think about it as a controlled entry system. Folate is the item being delivered. The receptor, the folate receptor, is the checkpoint that verifies it and allows passage. When the system works smoothly, what happens? Well, when the system works smoothly, folate reaches the brain in a consistent and regulated way that is beneficial to the body for growth and neurological development. During early childhood, this transport process becomes especially important, doesn't it? The developing brain has higher demands and relies on steady nutrient delivery. If folate transport is less efficient, the brain may receive lower amounts than expected, even when overall folate intake appears to be kind of adequate. Now, this brings us to the why, and also brings us to the topic of antibodies. What are folate receptor antibodies? To understand the next layer, it helps to briefly explain antibodies here. So antibodies are proteins that are made by your immune system. Their usual role is protective. They help identify and respond to things like viruses, bacteria, and other foreign substances or foreign invaders. In most cases, antibodies work exactly as intended. Occasionally, however, antibodies can interact with the body's own proteins. When this happens, they may interfere with normal function rather than support it. So they interfere instead of their usual job, which is supporting it. This is a recognized immune pattern and not a deliberate process. So folate receptor antibodies are antibodies that bind to the folate receptors that I described earlier. Instead of targeting an infection, these antibodies attach to the receptor itself. And when they do, they can reduce how effectively folate binds and passes through. Researchers became interested in these antibodies because they can affect how reliably folate reaches the brain. This is particularly relevant during periods of brain development when consistent nutrition and nutrient transport plays a larger role, a central role, doesn't it? So what is cerebral folate deficiency, or CFD? The body needs folate, right? But having enough in the blood doesn't always mean the brain is getting enough. Cerebral folate deficiency, or CFD, describes this situation. In CFD, blood folate levels can appear normal, but the folate inside the brain is lower than it should be, often significantly so. This happens because folate must pass through the blood-brain barrier using specialized transport systems that I described earlier. Now, if these systems don't work as efficiently, the brain may not receive enough folate even when the blood supply is adequate. Standardized or standard blood tests measure folate in circulation, not inside the brain, which is why a routine blood test can appear normal even if the brain is undersupplied or deficient. Now, why does this matter in autism? What is the importance? So autism involves differences in brain development and connectivity. The way neurons communicate, the formation of protective myelin around the nerve fibers, and the efficiency of signaling pathways can significantly vary among children with autism. Folate contributes to these processes by supporting the growth and function of neurons along with their connections. In some children, disrupted folate transport due to factors like folate receptor antibodies may reduce the amount of folate available to the brain. I think we all understand this aspect right now, right? Based on what I've explained in this podcast so far. Okay, now, researchers have observed that some children with autism show differences in folate-related biological pathways. These pathways help brain cells work and grow, which is why doctors and scientists study folate in autism. Makes perfect logical sense, doesn't it? This research does not assume folate differences explain every single case of autism, and that the exact links to brain communication and nerve development are actually still being studied. It's important for all of us to stay current and stay in touch with the latest research with respect to autism so we can help our children, and in my case, my patients, the best way possible. One important question that I'm always asked is, what is the connection between folate and speech and language development? So let's take a few minutes and try to understand that connection. Speech and language depend on many parts of the brain working together smoothly. Brain cells or neurons send messages quickly. The connections between different brain areas must work well to understand sounds, form words, and speak clearly. Folate supports these processes. How? Well, by helping brain cells produce energy, create chemical messengers, and stay healthy, so communication pathways remain stable. Folate also plays a role in making myelin, a protective coating that surrounds nerve fibers. Myelin helps brain signals travel faster and more accurately. When these signals move efficiently, what happens? Something amazing. Children can process sounds, learn new words, and coordinate the muscle movements needed for speech. Folate is involved in brain pathways that support learning and adaptation over time. These pathways allow the brain to adjust as language skills develop. By supporting these systems, folate helps maintain the speed, timing, and also clarity of brain communication that is needed for speech and language development. Researchers have studied this connection more closely. In studies including randomized placebo-controlled trials, children with autism and language challenges who received high-dose folinic acid showed improvements in verbal communication. Folinic acid is a form of folate that can reach the brain easier even when folate receptors are partially blocked. In one double-blind study, children showed better scores in expressive language and overall verbal ability after 12 weeks of treatment. Improvements were stronger in children who tested positive for folate receptor antibodies. Interesting, isn't it? I will link to these studies in the description as well. These findings suggest that improving brain folate activity may support the neural pathways involved in learning words, forming sentences, and participating in conversation. Now, how do doctors and other autism clinicians investigate folate-related issues? When clinicians want to understand if folate transport may be affected, they may order a folate receptor antibody test or the FRAT, F-R-A-T test. This test measures whether antibodies are present that could interfere with folate receptors, potentially reducing folate availability in the brain. The FRAT can help identify cases where folate transport is not functioning optimally, providing one piece to the puzzle of the overall assessment of a child with autism spectrum disorder. Now, clinicians may combine FRAT results with other supportive evaluations based on their clinical experience and expertise, including metabolic profiles, nutrient level assessments, organic acids, and so on. In some cases, lumbar puncture is an extreme, obviously, but it is an option to directly measure folate levels in the cerebrospinal fluid, providing a definitive assessment of cerebral folate deficiency. I've heard about this kind of testing being done for children with global developmental delays or like serious issues, which is not just your basic autism spectrum disorders. These are children with far more debilitating global developmental issues. That's something important to keep in mind. Now, it's also important to keep in mind that a single test does not provide a complete diagnosis. Results must be interpreted in context with other clinical information, the child's developmental history, and the additional labs that the clinician did. Well, those laboratory findings are important as well. The FRAT is an investigative tool rather than a definitive answer that helps clinicians explore how folate-related mechanisms may relate to brain function and speech and language development. So today we've covered several key pieces of folate biology. We looked at how folate moves from the blood to the brain, the role of folate receptors in that process, and how folate receptor antibodies may sometimes interfere with folate delivery. We also explored cerebral folate deficiency, CFD, where folate may look normal in your usual blood testing, but the folate levels in the brain are low. And why this distinction matters for brain development, and in some children, for their communication pathways in the brain. Grasping these concepts provides a clearer picture of how folate functions in the brain and why researchers pay such close attention to folate transport, folate receptors, and folate antibodies. This understanding lays a foundation for thinking about how folate biology can relate to child development and assist in additional clinical investigations for helping the child achieve their highest potential, right? Both speech, language, education, cognition, life skills, become a productive member of society. Now, this was the first of the series that I mentioned earlier, right? So next I will be speaking about leucovorin. Your practitioner obviously will give you a lot more information. This is just for educational purposes so that you know what is available out there. What are the different options open to you? Okay, cool. So I'll see you at the next episode of the BioNexus Health podcast. I hope this has been educational and helpful, and I'll see you soon. Be well, keep smiling.